Hi, Dr. Sree. She is a researcher at Tagore Medical College in Chennai and has been doing sterling work on THR. She is instrumental in putting together AHRER and drives the initiative from the front. What motivated you, or what was the need? What got you going into forming a body like AHRER?
Initially, in 2018 and 19, we were part of some international conferences, starting with the Global Forum of Nicotine in Warsaw, Poland, and followed by other Asian harm reduction conferences in South Korea, Australia, where we get to see the international medical professional bodies leading the research and policy involvement activities and policy measures in their own countries in national levels uh, regarding their tobacco control and tobacco harm reduction activities from research to policy making. When we were brainstorming with international researchers and such scientists, we realized that there is a gap in India where such medical professionals initiative was missing, and we immediately thought we have to replicate such international models in India also, where clinicians and medical professionals and public health researchers and diverse medical professionals led body can actively be part of policy making related to tobacco laws in India too. With that kind of exposure at international forum, we came back to India and started looking at what kind of efforts are needed to initiate such an association in India. And with guidance and mentorship from Samrat Chaudhary, because he has seen a lot of international exposure because of his efforts in consumer advocacy. With his able guidance, we were able to take certain efforts in early part of 2020, January. We started in January 2020, and it almost took us 3 months to get the paperwork, registration work done with the help of consultants. And by the time we registered in March 2020, the global pandemic shaped up our in a very critical manner, and entire global scenario took a very different, challenging way. And we had to still go ahead because it was our passion and it was our vision to start something like this in India. In spite of global pandemic, global lockdowns, and a lot of challenging things happening in the past 1 year, we went ahead. We made the virtual meetings, and we conducted a lot of activities in the global pandemic scenario also, which motivated us that we have to keep this going. So that was the reason, with the international exposure and with the sponsorship and scholarship contributions from various conference secretariats for me, because I presented my research work, I felt that there is a need for such a body in India, and we started this.